After high school, I went out to Colorado to be a ski instructor, and I actually broke my leg. Because I had that experience of such a traumatic injury that needed orthopedic surgery, and I saw the end result of what I was able to get back to all the activities that I loved doing after the surgery, it grew a passion for me for that field. I'm an orthopedic surgeon, and I am fellowship trained in the shoulder and elbow, but I enjoyed tackling all types of orthopedic issues. From basic fractures to sprains and strains. I do knee replacements, shoulder replacements, and complex arthroscopy in the shoulder and knee. I see young patients and athletes all the way up to older patients that need joint replacements. The first visit with me is very important. That's when I get to meet you. I get the background history of why you're having symptoms or complaints. I will oftentimes get x-rays as a baseline to know what condition your joint is in. And at that point, we'll kind of go through all the conservative treatments that you might have tried. I am a surgeon, but the surgical side of things is always kind of my last resort. What makes a surgery more successful is the fact that you've exhausted all conservative care, and then we've gone down that route first. And then when you finally make the decision, hey, surgery is ultimately the best choice, you feel confident that you've left no stone unturned. When you have surgery, you get the best implants, the best technology, the best staff. We've developed the ability to take a CT scan and reconstruct a patient's shoulder. That makes a complex reconstruction much, much easier. What actually happens is we take that CT scan and we generate a 3D printed patient-specific guide that will only fit that patient. It allows me to do their surgery on the computer before I ever do it on them actually physically in the OR. I always say after a patient maybe has surgery in my practice that they become one of the family. What starts out as an injury that you treat ends up, you'll see them years later for something else because you develop that bond. What's most important to know is that I take this very seriously. I consider everything about your care, not only what treatment route we pursue, but also all the details that are involved in seeing someone through to the end of their care. What makes me happiest is that they get the best treatment possible.